Why are fewer chambers available for emergencies? By Marty McCafferty, performed by Dr. Franz Cronier. As many healthcare institutions face increasing pressure to control costs, the availability of hyperbaric chambers for diving emergencies has been limited significantly. Although there are approximately 1,300 hyperbaric chambers in the United States, only 130 accept patients on the basis of urgency. In the United States, there are only 2 chambers dedicated solely to divers. All the others provide wound care as their primary activity. With fewer hyperbaric facilities available for emergencies each year, those that are available have become overwhelmed by the burden of covering larger and larger geographic areas of responsibility. Emergency department physicians frequently contact Dan to help them identify the available chambers for the most serious patients. It is not unusual to find that the closest facility cannot accept patients because the chamber is in use for another emergency or unavailable, necessitating an expansion for the search range. Compounding the problem is that some injured divers are turned away because of a misconception that divers need a level of care that is beyond what the facility is able to provide. In fact, divers are generally healthier and more stable than the average wound care patient. Nor do injured divers need a chamber that can be pressurized to more than 2.8 atmospheres or 18 meters seawater, as is mistakenly believed by some healthcare providers. The standard of care for the overwhelming majority of diving injuries is the United States Navy Treatment Table 6, or USN-TT6. This treatment protocol doesn't exceed 2.8 atmospheres, and a monoplace or single-occupant chamber is capable of providing that. So what do hyperbaric chambers treat? The Undersea and Hyperbaric Medical Society, or UHMS, has approved the following conditions for treatment with hyperbaric oxygen. Insurance companies will typically not cover the cost of HBO for conditions other than these, and they include the acute indications of crush injuries, compromised skin grafts and flaps, central retinal artery occlusion, which means the blood vessel supplying the eye is cut off, acute peripheral arterial occlusion, which means that a blood vessel to a limb or the periphery of the body is occluded, severe blood loss anemia, decompression sickness, air or gas embolism, burns, carbon monoxide poisoning, sudden sensory neural hearing loss, necrotizing infections including necrotizing fasciitis and gas gangrene, and intracranial abscesses. On the non-acute indication spectrum, there are selected problem wounds, mostly diabetic, delayed effects of radiotherapy, and chronic refractory osteomyelitis. How do chambers get funding? Well, HBO facilities primarily run on the non-acute indications. Because these indications are not as time-sensitive as the acute ones, patients can be scheduled and insurance coverage addressed in advance. These indications basically pay the bills of hyperbaric centers, and the payment for services are also more predictable for these patients. Other factors, though, beyond finances, can affect a facility's ability to be available 24/7. As recently as 10 years ago, the majority of hyperbaric centers were located in or attached to a hospital, which meant that most patients requiring HBO were already treated at the hospital. Income generated by treating the scheduled patients provided enough financial support to allow the hospital to also offer after-hours emergency hyperbaric care. This also made it possible for comprehensive treatment of emergency patients to be provided, because there were support services such as critical care, vascular surgery, neurology, and so on. Reimbursement for hyperbaric facility costs by insurance companies, and especially Medicare, is the same whether a facility is available for emergencies or not. The cost of having staff on a 24/7, 365 basis, though, can be substantial. So by accepting emergency and critical care patients, the potential liability and risk to the facility is much greater, and it could increase the liability for insurance costs for the physician group and the hospital as well. In recent years, Non-hospital-based clinics have therefore dramatically increased, primarily due to an increase in the number of patients that benefit from the non-emergency treatments. Patients in stable conditions who require multiple scheduled treatments are also more likely to use the facilities that are closest to them. So this migration away from hospital has reduced the chambers that are available and are able to absorb the additional costs that are incurred by accepting emergency patients. Several years ago, one hospital-based hyperbaric facility announced publicly that it was planning to end its emergency hyperbaric services. In an average year, it treated 10 to 15 acute patients. Compensation for these treatments came nowhere close to offsetting the costs by being available all the time. This is a reality that many facilities face. In this case, local divers organized themselves and were able to persuade the hospital to continue emergency services. DAN and undersea and hyperbaric medical societies and associations. DAN continues to work with all healthcare professionals, including pre-hospital care providers, to educate them about diving injuries and treatment. DAN also works continuously to stay up to date on each chamber's operational status and their willingness to be able to provide emergency care. Undersea and hyperbaric medical societies and associations throughout the world promote diving and hyperbaric medicine and are therefore trying to find a solution together with DAN for the increasing shortage. Some in the field are working with appropriate government agencies to address potential reimbursement incentives and remove obstacles that will encourage more emergency facilities. One proposal at the moment, which is under consideration, is having similar capable facilities in a given area, providing emergency care on a rotational basis, and thereby avoiding placing undue strain on one single facility. So what can divers do? The diving community can influence the availability of chamber facilities for diving emergencies. First, divers should make certain that they have insurance that covers hyperbaric treatment, whether through their primary medical insurance or through the coverage that is provided on a secondary basis through Divers Alert Network. A community of insured divers means that facilities that provide this care are likely to be paid appropriately, which is an important consideration for hospital administrators to keep the doors open and the hospital solvent, and they'll therefore be less reluctant to treat injured divers. Divers can also use social and news media to bring attention to this situation. We should, as a community, emphasize the need for emergency hyperbaric treatment, not only for divers, but also for other potential indications for HBO. Acknowledgement of the serious financial challenges that these facilities face should help foster a productive dialogue amongst all the interested parties: care providers, local communities of divers, hospital facilities, and so on. Only through dialogue and cooperation can an ideal solution be found.